Today, we are going to see one topic from our psychology, that is guidance and counseling, which is very important topic of our psychology and in our whole nursing. So, these two different words, guidance and counseling. So, you can see here the image of guidance, that means the person is giving support to another person, and counseling, that means one person is getting help from the another trained person for the solving their problem. So that is the counseling. So these two different terms are there, that is your guidance and counseling, that we are going to see in detail in today's lecture. So first we'll start with the guidance. So as I told you, that guidance is giving someone a support or a providing assistance to someone. So that is our guidance. Let's see in detail about this guidance. So coming to our definition of guidance, which is given by the James A.J. in 1951, who is a psychologist. So guidance is the help given by one person to another in making choices and adjustment and in solving problem. So you can see in this image that one person is giving help or advice to another person. So this one friend is giving help or giving support to another person. So that is your guidance. So for what reason he is giving support? That is in making choices and adjustment. So if we talk about the psychology, for all the human beings, it is very important to adjust with the self as well as the surrounding environment. So that adjustment is needed in all the areas and all the aspects of our human beings' life. So guidance will help us to make the choices, what to do or what not to do, for what options we have to go or for what options we can't go. So that choices will be helped by this guidance. And the another thing is adjustment. So we can adjust with ourselves as well as the self of other people surrounding us, at the same time the surrounding environment in the sense of any objects, any circumstances, any situations or any other people. So that is adjustment. So to help or to solve the problems in all this area, that will be called as your guidance. By confront him in the attainment of goals. So that means face to face we can react to that particular situation, or we can get help to solve that particular problem. So that is called as your guidance. So this is your guidance, in which one person is going to provide help to another person in one thing, that is making choices about self, adjustment and solving problem by confronting that situation directly face to face. So that is the definition of guidance, which is given by James A.J. in 1951. In guidance, the next is principles of guidance. So here are 14 principles which is given by Crow and Crow. So that Crow and Crow is also a psychologist who has given the 14 principles to understand that how should be a guidance, what type of guidance we have to give to someone, some individuals who are in really need. So that principles are here. The first one is all-round development of the individual. All-round development, that means all the areas of human beings' life, whether it is spiritual, whether it is social, whether it is personal. So in all these areas, to achieve the goal, to establish a new goal, the guidance is going to helpful. So that will be called as your all-round development. Next principle, that is second one, recognize individual differences, which is the most important one. When we are giving guidance to someone, obviously the individual differences will be there in the sense of age difference, in the sense of difference in their thinking pattern. So that things we have to focus on. For an example, I am giving guidance to one person in same situation. For other person in same situation, if I am giving the guidance, but both the people, the age difference might be there, their thinking pattern might be different. So the guidance will be different according to their needs. So that thing we have to keep in our mind while we are giving the guidance, that individual difference matters. The next one is third one, that is formulating and applying goals of behavior and conduct of persons of So with the help of guidance, we can help someone to formulate a goals for their life. So they can formulate a goal. For an example, I have one of my friend who is confused in any areas of their future aspects, that what they have to do, what they should do. So I can give them advice, or I can support them that in which line they can go, or what decisions they can take, what choices they can select. So that is called as formulating a goal. So we can advise someone that what type of goals they can formulate. So that is guidance. The another thing, after formulation of goals, we can help them, or we can guide them to apply that goals, that how they can apply their goals, how what type of implementation they can do while they are working for achieving their goal. So that thing, so that is called as conduct of person's affairs. Conduct in the sense of the behavior of the individual, what they have to do, what they have to carry out in the sense of getting that, in the sense of achieving that goal. So that is called as formulation and applying goals, as well as conduct of person's affairs. So that is the another one principle. Coming to next, the fourth one, that is existing social, economic and political unrest. So that means in our human being lives, not every time our lives will be settled one. Okay, so there will be some social, some economic and some political unrest will be there. That means sometimes we'll be dissatisfied by our social life, sometimes our economical life will not so much good, and we will be dissatisfaction, will having the dissatisfaction from our economical life. So that is also the problem. So as we have discussed earlier, that means the human being is needed the adjustment with their self and the surrounding environment. So when all these areas goes wrong in our life, at that time we need the guidance. So in our guidance, we are going to include this social, economic and political unrest, so that human being or a person whom we are giving the guidance, they can cope up with that situation. So that is the social, economical or political unrest. The next principle is continuing process of service. So obviously, in all the areas of our life, we need a continuing process of service. For an example, I have started living my life from my childhood to the area of growth or development. When I am growing to my adulthood, then my old aged period, I need a guidance. All the individuals will need a guidance in one or another area of their life, whether it is that is financial area, whether that is the economical area or health areas or educational areas, we need a guidance. So continuing process, all the time we are getting educations. For an example, when we were in our childhood period, we were getting guidance from our parents, what to do, what not to do, how to eat, what to do, like that. When we have shifted into school, when we have started our schooling, at that time we are getting guidance from our teachers. So that is, so the guidance is a continuing process, the lifelong continuous process, the guidance is. Next is the sixth one, extended to person of all ages. So we can understand this by the above example, that from childhood we have started getting guidance to old aged period. So all the age groups are included. This guidance is extended to all the age groups. That means all the age groups, whether they are small, whether they are kids, whether they are adult, whether they are old aged people, they need some guidance in all the areas of their life. So old aged people will also need the guidance in selecting their healthcare facilities or taking decisions for their treatment or any other areas. So likewise, all the persons in all the ages, they requires the guidance. So that is. The next principle is seventh one, curriculum, materials and teaching procedures. So whenever we are preparing our curriculum, materials and teaching procedures, at that time it should include the guidance as well, because students also requires the guidance how to write their examination, what future aspects they have to go for, what streams they have to select. So in all that areas they need the guidance. So whenever we are planning a curriculum material or any teaching process, at that time we should include this type of guidance in all that teaching materials or curriculum. So that is very important. The next one, 8 principles of guidance, that is individuals' physical and mental health areas. So we also have to include the individual physical and mental health areas. Physical in the sense of, for an example, I am physically ill, I am sick, my health is not good, my any extremities are not working properly. If physically I am having any problem in my any system, I have some issues at that time. Or my mental health areas, if I am mentally disturbed, I am depressed, I am stressful. So in that all the areas we need the guidance. So that physical and mental health areas obviously are going to affect their educational areas, their social areas, their personal relationships and everything. So in all these areas, physical and mental health, we need a guidance. So we need to include that also. The next principle, guidance pointed responsibilities of parents and teachers. So as we have earlier discussed, that guidance pointed responsibilities of parents and teachers. That means whenever parents and teachers should have the responsibility as a good guider, they should give a guidance in all the areas of our life. So that is, so parents and teachers also should have some responsibilities to be a good guide. So that is, the next principle is guidance problems should be referred to trained person in particular areas. So that is about specific guidance problems. If I am having some problem in my specific one area, for an example, I need a guidance in my educational area, that should be referred to educational guider. So that it means to say that in what area we have the problems, for that specialized person we have to go for. For an example, when we have the problem in our bones, we go to the ortho department, right? So likewise, if we have the problems in our skin, we go to the dermatological department because they are the specialized person in that area. So likewise, when we have these type of specific guidance problems in our educational life or in our vocational life, in our avocational life, in our personal life, at that time we have to go to that specialized person who are good in that. For an example, educational guidance if we need, then we can go to our teachers, we can go to our mentors. Likewise, all these areas need a specialized guidance person. So that is. The next point is individual evaluation and research. Again, very important, individual evaluation and research. So the person who is doing the guidance, they should have the individual evaluation. That means a progress card, cumulative record of the progress of other peoples who already went from that guidance. So they should have that all the data, so that they can do the research that how effectively they have done that, they have given that guidance, as well as that guidance was helpful for them or not. So for that reason, individual evaluation, all the individuals who got the guidance, the evaluation of that all the individuals, cumulative record we have to keep of all that individuals. So that thing we have to do, so we can do some, so we can get some interpretation and evaluation that what better things we can do in this particular area. So that is. The next thing is flexible. Okay, guidance should be always a flexible one. In all the situations we can give guidance, that should be a very flexible, very simple one. Then next is responsibility for administration. Responsibility for administration. That means, for an example, I have one organization. The example is our school, right? So if school we have, the one responsible person should be there for in charge of this guidance, to plan this guidance program. Likewise, for an example, one qualified or one eligible chairman should be there to conduct all this guidance program. So one responsible person or chairman should be there whenever we are working in any organization for administration of this guidance program. So that it is. The another one thing is periodic appraisal. So whenever we are talking about guidance, it should have the periodic appraisal. For an example, today I have given the guidance to someone. So I need to appraise that guidance program, that it was effective or not. So whenever we are carried out this guidance program in our organization at that time, we should go for the periodic appraisal, that whatever guidance program we have established, we have organized and we have implemented on that, that was really effective for our organization, for our clients, for our students or not. So that periodic appraisal we have to do, the evaluation we have to do that it was effective or not. So these are the principles of guidance. When we talk about the effective guidance, it should follow all these things. So that was about principles of guidance. Coming to our next point, that is our areas of guidance. So as we have discussed in principles, specific guidance problem, we need a specific person or trained person in that specialized area. So likewise, here are some areas of guidance. The first one is educational guidance. So whenever if we talk about this educational guidance, specially students will be involved in this type of guidance. So in this educational guidance, students will get the guidance or support or assistance about what stream they have to select. If they are passing from 10th standard, that science stream they have to go for, or commerce stream or art stream they have to go for. So that is for selection of that stream, the guidance, educational guidance is very important. For an example, what profession they have to select, so that will come under the vocational guidance. So that is your vocational guidance, that after getting the education or after during getting this educational qualification, which profession they are going to select. So they have to start establishing their goals from that point of only. So that is your vocational guidance, what they have to do. The next is your personal guidance. Personal guidance in the sense of in our personal life, in our personal affairs, if we have any problems, at that time we can guidance. For an example, if I have some family issues in my family, in my life, so I can go to take help from my any friend, so that they are going to provide us a guidance. So that is our personal guidance. The next one is our social guidance. Social guidance in the sense of in our societal affairs, if we have any issues, if we are facing any problems with our society, how to react in our society, what we have to do in our society, what we have to do for our society, the group work, what we have to carry out in our society, how we can develop a team in society, rituals or things, how we can participate, that involves all that areas. So that is our social guidance. Next is our avocational guidance. Avocational guidance, that means away from your vocational guidance. In vocational guidance, we were going for our vocational things related to occupational, what we have to select, what we have to go. We have to go for which profession or which field. So that was about our vocational guidance. Here it is a avocational guidance. Apart from our vocational things, apart from our occupations, our jobs, our field, what extra things we can do, what extracurricular activities we can do. For an example, where I am using my leisure time, if I am getting any free time from my job, what activities I am doing. So we can advise that type of things to our clients or our near and dear ones, that what avocational things. For an example, the one person is interested in playing cricket or basketball, we can give them advice to use their leisure time in that cricket or basketball, or any creativity activity like painting, drawing and everything. So that is called as your avocational guidance. The next is our health guidance. When we are ill, when we are sick, we go for the health assistant. So that is our health guidance. In what hospitals we have to visit for our particular problem or our health disease condition, what we have to do, what type of treatment we have to select. So that all the things which is involved directly or indirectly with our health, that will come under this health guidance. The next is our financial guidance. Financial guidance, that means any unrest in my financial condition if I have, then I have to go for this financial guidance, that if I am not earning if my earning is not satisfying my needs, so that is my financial guidance. If I am not, if I have some financial crisis in my life, I have to go for the financial guidance. So that is the area which is dealing with your financial guidance. So here we have this 1, 2, 3, 4, 5, 6 and 7 areas of guidance. Different areas or different problems we can say, different guidance problems. So that is that. Okay, after next. So here you can see some images what this image says? This is educational guidance. The second one that shows you the social guidance. See, these friends are talking with each other to solve their social things. The next shows you this vocational guidance. This lady is explaining that student that what type of occupation she can go for. So that is. So here few images I have taken for your areas of guidance. Okay, so that was all about your guidance. The next, after guidance, let's see another topic, that are counseling. What is counseling? So you can see in this image, two people are sitting with each other. They are doing some communications. Both are actively involved in this process. So that is called as your counseling. The one is counselee and the another one is your counselor. So whenever we are talking about this counseling, it is going to include this one counselee who is getting help from someone. So that is your counselee, and the one person will be the counselor who will be the trained professional in that particular area. So that is your counselor. So let's see what is counseling. So here is the definition of counseling. Counseling is an interactive process. Interactive process, as we have seen in this image, here it is also. Interaction is there. He is also saying something, he is listening and responding. So that is an interactive process that facilitates meaningful understanding of self and environment. As we have discussed earlier in our psychology, to be mentally healthy, we need to adjust with ourselves as well as the self of other peoples and with surrounding environment. So here they are doing meaningful understanding. That means this person who is a counselor, he is understanding the another person, that is the counselee, and vice versa, counselee is also understanding the counselor. So that is interactive process and meaningful understanding of self and environment. So this counselor is going to help or is going to assist the counselee to understand himself as well as what is going on in surrounding environment of him. So that is, and result in the establishment and clarification of goals. So when we are so much confused, when the counselee is so much confused, at that time they can go for the help from the counselor, and this counselor is going to help them to understand themselves, what they are thinking, what is their goal, what they want to do, and they will help them to clarify the goals, what they needs to do in their lives. So clarification of goals will be there, and values for future behavior, what type of behavior they have to exhibit. So that is your counseling. So this counselor is going to help the counselee to solve all these areas, the goal clarification as well as values for future behavior. Future behavior in the sense of what type of behavior they have to carry out, what steps they have to implement, what conduct they have to implement. So that is the values for future behavior. So the very simple, counseling is an interactive process which facilitates understanding of self and environment, and after understanding, it results in clarification of goals, because when this counselor is going to understand the counselee, at that time only he will understand that what kind of goals the counselee should be. So that is the interactive process and understanding of self and environment. So both the persons, counselee and counselor, are understanding each other, because counselee is also understanding this counselor. So that's why he is getting what type of goal he is clarifying for him. So that is, and this definition is given by Stone and Scherzer. So they are also psychologists. So that was about the definition of counseling. Let's see further about this counseling. Next we have the principles of counseling. First, priorly we have seen what is counseling, and next is the principles. don't forget, we have also seen the principles of the guidance. So this is the principles of counseling. The first one is your respect. That means whenever a counselor is doing the counseling, at that time he should have a respect for the counselee. They should be a non-judgmental to the counseling. They should not think that the counselor, that means I am the superior one. So we have to give response. We have to give respect to our counselee, the whom we are doing the counseling. So that is the second one is authenticity. That means being non-judgmental as well as not being a superior. We are not there to show our power to that particular person or individual who came to us to get some help. We have to be very humble, very honest. So that is your authenticity. The third one or next principle is your non-possessive warmth. Non-possessive warmth, that means warmth you should have. You should have a warmth for counselee whom you are doing the counseling. The warmth is there, then only we will be able to understand them, because our role is to understand them, to listen them, to react on them. So that for that reason we need a warmth, but at the same time the non-possessive warmth. We don't have to be a very possessive for that counseling. So that is. The next is non-judgmental attitude. So always when we are counseling someone, we should have a non-judgmental attitude as a counselor. That means we cannot judge for an individual for their wrongs and rights. We cannot say them that yes, you are right here, you are wrong here. We cannot judge any people. So that non-judgmental attitude we should have when we are doing the counseling. The next is accurate understanding of the client. Accurate understanding of the client, that means our perception as a counselor, what they want to share with us, what is their perception, we need to understand that exactly. The wrong signals we are not misinterpreting. So that is accurate understanding of the client we should have. What they are sometimes, their non-verbal response, their behavior, the way of their talking or sharing things, that also we need to understand, so that we can identify that in which conditions they are not comfortable and what kind of problem that particular person is having. So for that reason we need to be accurate understanding of the client. The next principle is recognizing the client's potential. Recognizing the client's potential in the sense of the client we have, we should be knowing about the strength and limitations of that client, that what they can do. So based on that, we can provide some alternatives to solve their problem. So that is the very important thing. We need to recognize the potential of our client. And the most important, the last one is your confidentiality. Because if we don't be the confidential, they are not going to share any information with us. If they won't share information openly, then we won't be able to solve their problems. Then this counseling process is not going to work. So whenever we are working, we should be a confidential as a counselor. The counselor should be always confidential. We cannot share all the personal information of our client with some other people without their consent, or their data and everything we have to keep in a strict control of our. So that confidentiality we have to maintain. So that is the principle of counseling. So these are all the things we have to do if we want to do the effective counseling, or a good counselor we have to be. At that time we have to follow these all the principles. The next is who should be counseled. That means what type of individual or what type of people we can do a counseling. So especially here we are learning this counseling and guidance for our students only. So obviously our persons will be the students only. So who should be counseled? So here I have collected some images. The first one, that is this. So any students in our classroom or in any areas we are getting, those who are progressively undergraduating. See, in this image you can see this is the test result paper and they are getting this poor grade. So the people, those who are getting a poor progress report, so they should be counseled. Priorly they were getting the A plus, A plus, and next they are getting the F. So that grade shows us some problems in that particular student. So we need to counsel them. So to them we have to counseling. The next image also the same. If the educational achievement, the dropout rate or dropping rate we are seeing in this educational achievement, scholaristic achievement, at that time also we need to counsel that particular person. So that thing also we have to do. The next image you can see, this little student is not able to concentrate on her study. So when the students are not able to focus on their study, they are not able to focus in the classroom, at that time also we have to do the counseling for them. So that in initial stage only we can identify their problem and we can help them to solve their problem. So it won't be developed to any other severe form. The next image we have, see, that shows the dropout rate from the schools. This student has left his school. So that is the dropout, sudden dropout. Suddenly if our child don't want to go to the schools, at that time also we have to do the counseling of that particular child. The next image you can see, aggressive behavior of our children, aggressive behavior of any students if we are observing in our school, in our classroom, at that time also we have to go for the counseling sessions for that particular children. Previously they were not that much aggressive, suddenly they are showing their aggressive behavior, at that time we have to go for their counseling. So that it is. Also, if the children or students are doing bullying at that school of other students, at that time also we have to go for their counseling. The next image, if the children is not even able to focus on any extracurricular activities like painting or drawing or playing any games, so if they are not able to give their attention in that also, at that time also we have to go for the counseling of that particular children. Apart from this, when the students are attention seeking, students are showing their attention seeking behavior by doing exhibitionism, that means exposing their own genital organs to someone else, someone stranger people, at that time also we have to go for the counseling because they are attention seeking behavior they are showing. Apart from this, if any behavioral changes we are observing in students, at that time we have to go for their counseling sessions. So that are the things what type of people we have to do the counseling, so that it is. Next is our types of counseling. What type of counselings we have? Let's see. Mainly, you can see in this image, two types of counseling we have. The first one is the individual counsel. Then second one is your group counseling. So you can see, name itself suggests individual. That means one counselor and one counselee will be there. So that is your individual counseling, one and one. Two people only will be there in this counseling process. So that is your individual counseling. The second one is group counseling. That means one counselor will be there. So you can see, she is the counselor and other group members are there. So that is called as your group counseling. So when we are doing the individual counseling, in first attempt we are going for the individual counseling when the person is having any personal issues, any social issues, any educational issues, to solve their problem, to get them help to understand themselves better and to formulate some goals, we are helping them by this individual counseling. So that, but when the persons or that individual counseling, if we are not getting a good result, they are not at all responsive to us, they are not cooperating us, at that time we can go for the group counseling, because by this group counseling we can help them to ventilate out their feelings. So if one people or a one group member is ventilating out his feelings, at that time the another people is going to observe them, and they also will be provoked or motivated to share their thoughts also. So that is called as group counseling. When in individual counseling, the person are not at all responsive to us, at that time we can shift to our group counseling, so that people will be motivated by seeing or observing other individuals sharing their thoughts and everything. So they also will be motivated, and they will be opening their feelings, and they also will ventilate out their feelings. So that is the group counseling. At the same time, the group counseling we are going to do so that the one individual is going to share their strategies, what they have done or what type of goals they have established. So they other people, other group member also will observe that goals, and they are also going to formulate that same thing. They will also think something good for their self. So this is how it motivates other peoples also. So that's why we are doing the group counseling. So this is the difference between individual counseling and group counseling. Mainly group counseling, the more than 2-3 peoples will be there in group, and in individual counseling only 1-to-1 interaction will be there. So that are the types of your counseling. Coming to next point, that is our phases of counseling. So counseling is a whole process, something different from guidance. Guidance in that just assistant or a support we are going to give to other individuals. But here in counseling, that is a very lengthy process what we are carrying out, that will be seen in the stages. So here we have the phases of counseling. Let's see how the stepwise this phases process will work of counseling. So in phases, this is the first phase, or we can say first stage of counseling, that is the appointment and establishing relationship. So before starting our sessions of counseling, the very first and foremost thing we are going to do is appointment. So we are going to fix the appointment for counseling with our client. For an example, I am the counselor. I am one individual was there coming to me to getting any help. So at that time I am going to schedule an appointment on a time which is convenient for both the parties, counselor as well as the counseling. So that appointment, that thing we will do. After fixing the appointment, we are going to establishing the relationship. That means the first introductory phase, we can say establishing relationship. That means the counselor will try to open up with the counselee, and they will try to develop some trust and hope in the counseling process, so that the other party can open up with us. So that is establishing relationship. In that, trust we are gaining of the counselee, or we can say opposite party or a client. So that is your first step or a phase in which appointment we are fixing and we are establishing the relationship. Coming to our next step, that is our assessment. So name itself suggests assessment. That means we are assessing about the data. We are collecting the data of the individual, the counselee. We are collecting data from him, from that particular client, so that we can identify that what type of problem it has. So for that reason, we can talk to their any other relatives, or we can directly collect data from their case paper, or we can collect data from some neighbors, some relatives, or that own individual of own client. So that is the assessment phase, in which we are gathering all the informations and all the data about our client. So that is our assessment. The next is our diagnosis. So after collecting data, after gathering the information about the client, we are going to interpret that information, that what actual problem our client is having, what are their problem, what is the diagnosis. So that diagnosis we are going to formulate, that what type of problem our patient is having. So that is your diagnosis, the actual problem of that particular individual. So that we are going to interpretation of the problem we are going to do from the collected data and the conversations what we have done in this second step. So from that, diagnosis or problems will be identified. After the diagnosis, after the identification of the problem, the next step we are going to do, that is setting goals. Goals we have to set for our client, that now we get to know that this is the problem of this particular client, then what we can do. So next is your setting goals. So that means short term goals and long term goals we are going to set for our client. So short term goals, that means your immediate goals, what we have to do, what needs are there to be fulfilled immediately. So that is your short term goals we are going to set for our client, and the long term goal we are going to set for our client, that how we can solve their actual problem, what we have identified in the phase of diagnosis. So for that reason we are going to settle the goals. Now goals we have settled. After that, the next step is your intervention. Now we have the goals, what we need to do. So from that goals, we are going to plan our interventions, that what we are going to do, the things we have to implement, what steps we are going to take now to solve that particular problem. So to improve the behavior of that individual or to solve the individual's problem. So that things we have to do. So that is your interventions. We are going to implement whatever goals we have settled. For that goals to achieve that goals, we are going to plan something. We are going to plan something and we are also going to implement what we have planned. So that stage is called as your intervention stage. So in this stage, actually all the problems of our individual or a client will be solved out. And after that, we are going to do, we have the last stage, that is our termination and follow-up. So the termination and follow-up stage. So as we have discussed earlier, counseling is a process which will require more sessions. So if this is the first session, we are going to plan for the next session. In this termination phase, we are going to plan for the follow-up. That means when next time we are going to meet. So that will be our follow-up plan. If this was the last thing in our counseling sessions, this was the last sessions, then what we can do, the termination. That means the counselor will also have the attachment towards the counselor, that how they will survive alone. The de-attachment will be stressful, that counselee also. So in this stage, we are going to help our counselee to cope up with that situations, that yes, this is the last stage and from next time you can take decisions for your life by your own. You don't need any support. So that type of motivation we are going to give them. So that is our last stage, that is the termination and follow-up. So these were the phases of your counseling process. In this process, we have to work. Coming to our next point, that is attributes and skills required for a counselor. Now, if I want to be a counselor or you want to be a counselor, what type of skills you require? So here are some skills which you will need to be a good counselor. So the first thing is pre-training attributes. Pre-training attributes, that means some specialized skills which you will need. For an example, listening. Good listener you have to be. Then questioning techniques you should have. So that is your pre-training attributes, that what type of qualities you should have for being a good counselor. The next is good psychological health. If as a counselor, my health is good, my psychological health is good, my behavior is normal, I am able to adjust with myself as well as surrounding environment, then only I will be able to help some other peoples to cope up in that situation. So for first thing and foremost thing which is important, that is my sound mental health. If I am psychologically healthy, I can help out other peoples. If I am mentally disturbed, I cannot help other peoples. So that is very important skills which is required for counseling, that is our good psychological health. The next is sensitivity. That is also very important. We should be a sensitive, that patient's problem or a counselor's problem, that should be a sensitive to us. We need to understand that problem. If we are not sensitive to that problem, if we are not understanding them problem, it will be difficult for us to solve that problem. So we need to be sensitive towards their problem. The next is open-mindedness. Open-mindedness, that means alertness we require to listen their problems actively, at the same time to reacting on their problem and to reacting on their behavior, we need a open-mindedness, that all the times we should be alert, so that we can listen them, and wherever it is required, we can give some explanation or suggestion to them. So that is, the next is objectivity. That means the being a non-judgmental, being very objective to that situation, to that counseling sessions, we have to be very objective, non-judgmental we have to be. So that is your objectivity. Then next is your trustworthiness. As we have seen, we should be a confidential. So here is the trustworthiness. So we can gain the trust of our opposite party or of our counselee. So they can share everything, each and everything with us. So we can identify their actual problem. So the trustworthiness is also very important. The next is your approachability. That means a counselor should be approachable. That means they can contact us anytime. They can get suggestions from us. So that type of gesture and posture we should have, not too much superior that everyone will have fear to talk with us. So all the times we should be approachable. Approachability should be there, so that they can be open up with us, and they also can be ventilate out their feelings with us. So these are some skills or attributes we can say which is required for a counseling process, for a counselor. Coming to next point, here are some guidelines for successful counseling. If I am going to do a counseling, how can I implement a successful counseling? So here are some guidelines. Let's see one by one. The first one is careful scheduling of the counseling sessions. If I am selecting a counseling sessions, if I am scheduling, that means conveniency for both the parties I have to look for. That client is also free, he is also convenient to that particular time. At the same time, counselor is also convenient for that time. Otherwise, if I am in hurry, that time is not suitable for me, I won't be able to give a proper time to that particular client. So that's why conveniency of the time, that we have to implement in carefully scheduling of our counseling sessions. The next is privacy and confidentiality, very common thing. We have to be confidential. All the things, all the informations of a client, we have to keep it confidential. So that we have to maintain privacy, we have to maintain. The next is gathering data. Before client visit our clinic for a counseling sessions, before that also this gathering or collection of data that starts. We need to collect all the informations about our clients, so that we can identify the problems of that particular individual easily. So that collection of data or gathering information about our client, that is also important one. The next is knowing own personality. Knowing own personality in the sense of the counselor's own personality, what they think, what is their own strength and limitations, what is their potential, what they can do. So if I know myself better, then and then only I will be able to understand someone else. So to knowing my personality is also very important. If we are being a counselor, then we need to know ourselves as well. At last, we have to be a good listener. If I am not feeling good in listening someone, if I am getting bored while I am listening someone, I cannot be a counselor. So we have to be a good counselor. We have to listen each and every small and single thing of our client. So that is the good characteristics, or we can say a good thing to be a successful counselor. So these are the guidelines what we have to follow if we need to implement or do the successful counseling. The next is techniques or approaches to counseling. So here are three main techniques what we can implement while we are doing the counseling process. So the first one is your directive counseling. The second one is your non-directive, and the third one is your eclectic counseling. One by one we'll see this all three techniques. So let's start with our directive counseling. So name itself suggests directive. That means direction we are giving. That means the counselor will be active participants and counselor is going to give suggestions. They are going to give a direction to the counselee that what they can do, what alternatives they have. Directly by their own self, they are going to give them a suggestion that yes, if you have this particular one problem, for an example, if one student we have, they are facing problem in study, that means the counselor directly will go and help them that yes, this alternatives you can use, likewise this type of timetable you can schedule, or that direction will be given by this counselor. So that is your directive counseling. Direction will be given by the counselor. The actively the counselor will give the direction. So that is our directive counseling. The next technique is our non-directive counseling. That means as a counselor, we are not going to give any direction to our clients or to our counselee, but we are getting suggestions from their self. We are asking them questions that what they can do, what they should do. So we are triggering their mind so that some alternatives or some choices will be coming out from their side, and from there only they are going to select one options to solve their problem. So that is your non-directive counseling, in which the counselor will give the options or suggestions that what steps they can take. So that is your non-directive counseling. The next one or a third one, that is your eclectic counseling. This eclectic counseling is the mixture of this both the techniques, that is your directive counseling and non-directive counseling. So as per the time what is needed, the counselor uses this both the technique. Where the direction will be needed, they are going to give the suggestions or directions, they are going to show the path, or sometimes in some situations they also will get the suggestions from the counseling. So this eclectic counseling is two-way process, we can say, and it is going to include both the techniques, that is your directive and non-directive technique. So these three are the techniques or approaches to counseling. After that, next we have the areas of counseling. What different types of areas are there which will need some counselors? What type of events or what type of circumstances in person's life will be there? At what point they will need some help from the counselors? So these are your areas of counseling. Let's see one by one. The first one is your counseling to relieve distress. So this distress is your problem area. When the person is having the distress in their life because of any other reasons, whether it is study or whether it is family issues, if they are having any distress in their life, you can see in this image, this girl is having some distress. So in this distress, to relieve this distress, the individual will need a counselor. So giving information about a problem. Giving information about a problem. When we need to know about some information, when we need to get some information about the individual's distressing events or circumstances at that time, so that we have to do. The next point is providing opportunity to reflect on the impact of the problem on daily life. So in this counseling process, what we are going to do, that what problems our counselee has shared with us, on that problems we are going to help them to reflect on that problem, to think twice on that problem. So after thinking, what reflections they are giving to their problem, so that it is matter. So we are giving opportunity to our client to think on that particular problem, that what they will do in this situation, what they should do in this situation, that type of thinking pattern of our clients we are triggering. So that is. So in day-to-day life, if they are having any hassles, they are having any distressing point, we are making them to think on that point, and they will give the suggestions to us, and we are giving them an opportunity to reflect on their thoughts. The next is helping to work out ways of reducing this impact or of coming to terms with it. So nextly, we are going to help them to work out on the ways. Now in second step, they have reflected on their thinking pattern. We have given them opportunity to think on their problem. Now in next point, what we are going to say? We are going to say them to suggest some alternatives to solve that particular problem. So which will work out for them, what type of activities or what type of solutions they have which will work out to solve their problem. So to relieve the distress of the counselee, we are going to do this counseling, that is counseling to relieve distress. The next area, counseling about risk. When the individual is in any riskful situations, at that time also the counseling process will be needed. So here the example they have given for clients who are reacting to difficult circumstances. For an example, you can see this is the teacher and this individual is there. So this girl might have decreased or dropped scholastic achievements. This progress card is there in this teacher's hand. So if this type of problem is there, how should be the reaction of the counselor? So that reaction will be, that thing will be dealt by this counseling about risk, when the children are at risk of getting some childhood disorders. So in that type of conditions, we are going to do the counseling. So this is the another area. The next is interpersonal counseling. Interpersonal counseling in the sense of when the individual is having any issues in their interpersonal relationship, in their relationship with family members, or there might be the personal relationships, or there might be the any relationships with their colleagues at their workplace. So in all these areas, if they are having any issues at that time, this will be called as a interpersonal counseling. So this is focused on change in life events. So obviously life events are going to be changed because of this type of problems. For an example, if I was having any quarrel with my colleagues at my workplace, so that is also life changing life events for me. It will be disturbing for me, it will be distressing for me to adjust in that situation. So that is called as interpersonal counseling. Sources of persistent distress. Sources of persistent distress. If I am not satisfied with my workplace, or if I am not satisfied with my any family with relationship of with my any family members, so these all the things will be the reason for our persistent distress. So that in the family or place of work. Okay, so that these two areas. Apart from these areas, we might have the educational areas or any financial areas and current difficulties in relationships. So in all these areas, if that means in short, interpersonal counseling, that means any relationship problems we have, the individuals are having at that time, we can go for this interpersonal counseling.